I will pass over to you.
Thank you, Nikki. Hello, everybody. Nice to see so many people here today. Hope everybody's holding up okay in these weird and strange times. So I have a presentation prepared, so I'll just share my screen.
Sorry, 1 second, 1 sec. I'm so sorry, Jason. Paul, yeah. Thank you so much for reminding me. The presentation is being recorded. I completely forgot to say that. It is being recorded, and it's being recorded because after this, it will be available for you if you want to watch it afterwards. Perhaps there might be things that are talked about that you'd like to have a look at, and it will be available for members. The recorded version that's available for members does not include any of your screens. It only includes Jason's screen. And as I'll be asking the questions, none of your names are visible, and none of you will be mentioned, etc., by full name. So yes, it is recorded, but please don't worry, you won't be being shared publicly anyway. I'm so sorry, Jason.
No problem, that's fine. Okay, so let me share my screen. Okay, so hopefully everyone can see that. I am going to talk today about exercise and hypermobility. So for those of you that don't know me, oops, something popped up. So I'm Jason Parry. I'm a clinical specialist physiotherapist in hypermobility and what's called an extended scope practitioner. And I work at University College Hospital in London, where I do new patient assessments, so where I sort of assess and diagnose new patients with hypermobility as part of the hypermobility service there, along with Dr. Kaz, who you probably are all aware of. So I work there, and I also work at the London Hypermobility Unit, which is currently based at the Wellington Hospital in London as well. And I'm also a member of the EDS UK Medical Advisory Panel. So exercise and hypermobility. So in this presentation today, I'm going to talk about why we should exercise, why exercise is important when you have this condition. We'll talk about barriers and concerns to exercise, different forms of exercise, different suggestions how you can exercise with HEDS or HSD, and exercise prescription. So why should we exercise? What's important about exercise? Well, aside from just hypermobility alone, there are tons of benefits just to exercise. So exercise can help with the prevention and management of diabetes, obesity, cardiovascular disease, hypertension, osteoporosis, depression and anxiety, and arthritis. So although you might have hypermobility, that doesn't preclude you from having or potentially getting all of these other conditions as well, just like everyone else in general society. And there's lots and lots of benefits of exercise to all of these things. So let's just briefly touch upon those just as a starting point. So diabetes, there was a cohort study done in 2007 of over 300,000 subjects looking at diabetes. And they found that the relative risk for getting type 2 diabetes was around about 30% less for people who did regular physical activity and regular walking. And this effect is completely independent of your BMI, of your body shape, of how, how big or so you are. And this benefit to exercise in prevention of diabetes also applies even in people who don't lose weight when they exercise. So even just doing the exercise without any weight loss still helps to prevent diabetes. So that's one reason. High blood pressure. So multiple clinical trials have shown that regular exercise can lead to a reduction in high blood pressure. And just walking alone seems to be adequate enough to make differences. So again, if you suffer from high blood pressure, this is a benefit as well. Exercise and lipidemia. So again, regular aerobic exercise will help raise your good cholesterol and lower the bad cholesterol. And a study in 2007 showed that endurance exercise raised that good cholesterol and lowered the bad cholesterol levels, independent of anybody's body shape as well, in older men and women. And that was a study looking at people between 50 to 75 years old who did moderate aerobic exercise over 24 weeks. And again, the effects of aerobic exercise on the blood levels of cholesterol were proven to be beneficial in a meta-analysis in 2007. And exercise and obesity. So again, obviously, as everybody knows, exercise can, of course, help with obesity, but of course, it needs to be combined with a reducing diet. There's the old adage that you can't out-train a bad diet. So you also need to try to think about, you know, what you eat in conjunction with exercise. But being fit and obese is much better than being unfit and obese. That obviously stands to reason. However, being fit and obese is better than being unfit and normal weight as well. So the literature tells us. So that's interesting to note as well. And exercise and stress, anxiety and depression. So there's lots of evidence that aerobic exercise is effective in helping to manage mild depression. And it's often extolled by GPs and clinicians as a means of treating low mood, anxiety, depression, where people are encouraged to go and exercise. It's a recognized treatment from the National Institute of Clinical Excellence in managing major depressive disorder and anxiety disorders. So again, lots of benefits with exercising if you're suffering from mood difficulties. And then, of course, there's all these additional benefits to exercise where it helps you to feel more confident about moving and improving flexibility of stiff parts of the body. And yeah, even hypermobile people can get stiff as well. It allows people to resume activities, helps to improve stamina, improves your endurance, the body's endurance, and as mentioned, helps with stress and tension release. There's improved tolerance to pain in some cases as well with exercises. And exercising obviously can help lose weight and increase tone, and helps to improve fitness levels and addresses deconditioning. So without going any further, you can already see there are tons of benefits to exercise with and without hypermobility. And if the effect of exercise could actually be wrapped up in a tablet and patented by a company, then it would be widely prescribed. It would probably be the most prescribed drug in the world if you could make an exercise drug. Now, in terms of exercise and hypermobility, whenever I discuss exercises, or often, I get greeted with some quite common responses. How can I exercise with my hypermobility? You've no idea how hard it is for me to exercise. My joints are unstable. My pain is really bad. My POTS gets in the way. My gastric symptoms limit me. And as for fatigue, and these are all very common phrases that I hear, and they're all very valid phrases as well. And I completely appreciate all of those. But exercise really is one of the mainstays of managing hypermobility. It's absolutely paramount. And paradoxically, it can really help improve all of these things here that I've just mentioned. Now, before we go on, I should give the warning to everyone to always make sure that you're initially cleared to be able to exercise by any medical practitioner whose care you may be under prior to undertaking any form of exercise program. So that's obviously really important to make sure that you're safe to exercise from a medical perspective. And of course, everybody is an individual, and hypermobility affects everybody in different ways, although there are lots of common themes amongst many people with hypermobility. Everybody still is individual, and there is obviously no substitute therefore for an individual assessment in order to determine the most appropriate exercise regime for each individual person to follow. This is ideally done, if possible, by a fully trained healthcare professional, such as a chartered physiotherapist, who will then also be able to monitor the effects of those exercises and adapt them accordingly for each person. But I do appreciate that not everyone always has access to a physiotherapist, but in an ideal world, that is the best thing that can happen, really. Now, in terms of the practicalities of physiotherapy, there are no recipes when it comes to exercise, physiotherapy, and hypermobility. So one of the things that I sometimes get asked by people, particularly if they haven't seen me before, or if they've just seen me for the first time for an initial consultation, where maybe I'll get a subjective history about somebody and a background, people sometimes say, well, can you send me a sheet of exercises? Can you send me the exercise sheet? And no, I can't, because personally, as mentioned, I like to treat everybody as an individual. So I like to do a good individual assessment of each particular person. And although many hypermobile people have common themes that tend to show up whenever they're assessed, everybody's a little bit different. So some people are stronger or weaker. Some people have tighter muscles, more flexible muscles. Some people have all kinds of different alterations and biomechanical changes, etc. So I don't have a generic sheet of exercises that I just dish out for people, because that wouldn't be appropriate. And also, you know, from an individual's perspective, I would hope that most people would also prefer a tailored, bespoke, individualized program specific to them, rather than a generic sheet of exercises. Because you're going to obviously get much better outcomes if an exercise regime is tailored to suit you in particular. So I don't have that sheet, and that's what I respond with. I say, no, we need to do things that are specific to you in particular. Now, as a physio, when we're training as physios, one of the ways that we're taught to sort of take histories and chart people when we first meet them is by using something like a body chart like this. And usually when we're in training, we are given case studies, or we do little sort of role play examples using these body charts. And more often than not, someone will come and say, yes, I've got a bit of a hamstring injury, and you'll mark a little squiggly line, you know, kind of in the hamstring area, and then you'll put a note here saying, oh yes, you know, constant hamstring pain for the last 2 months or whatever. And usually you've just got maybe 1 or 2 little bits on your chart. Now, whenever I see a hypermobile person in my clinic, usually the consultation tends to go a little bit like this. So I'll say, okay, so tell me a little bit about yourself. Do you have, you know, what are your main issues or problems? And I usually get told, yes, well, I've got issues with shoulders. My shoulders dislocate. You know, the one on the right dislocates and the one on the left subluxes. So, you know, they feel really unstable. Okay, any other bits? And they say, yeah. Oh, and also the same thing with my hips. So my hips feel really unstable. They tend to slip and move around a bit. Right, okay, so dislocation of your shoulders, subluxation of your hips, fine. Any other bits of you feel a bit unstable or loose? Yeah, funny you should ask, actually. My jaw is sort of moving around, feels really unstable. My thumbs are slipping around. My fingers, bend all over the place and fall out of joint. My knees are really unstable and slip, and my ankles, I'm always turning those as well, and I feel they come out of joint. I'm like, whoa, okay, fine. What about pain? Do you have any pain anywhere? Yes. I get pain in my upper back, sort of between my shoulder blades, and I get low back pain as well. That's been nagging me for quite a while. Okay, right, fine. Pain anywhere else at all? Yeah. I get neck pain. I also get pain around my shoulders as well, and elbows really ache me as well. Okay, fine. So lots of pain around the upper part of your body. Lower part? Yep. I get stiffness and aches in my thighs and my hamstrings and the back of my legs. My calves are really stiff and achy. Oh, by the way, did I mention that my wrist sublux as well? And then, so wow, okay, anything else? Yeah, I get terrible headaches and dizziness, lightheaded, brain fog. Oh, I guess I should probably mention my IBS and my gastric symptoms as well. And this is kind of the chart that I end up with. Usually a full chart full of stuff, the kind of thing that makes a lot of physios want to sort of scream and run for the hills. It's quite an intimidating picture if you're not very used to it. But this kind of a chart actually is a very typical kind of chart that I tend to see a lot of the time. But what we can see is there is a lot of stuff usually going on with many people, all kinds of things from pain, stiffness, joint instability, lightheadedness, gastric issues, and so forth. And that was very much borne out as well by a couple of papers that described some of the most commonly reported symptoms in patients with EDS. As you can see, it ranges from all of those things that I've just mentioned. So how do I approach it? Well, there's no substitute for a really good basic assessment. That's the key to this, the key to approaching and helping to put together a good rehab program for someone with that sort of a presentation. So that starts with a good subjective history. And that includes taking a good thorough history of people's pain, their dislocations, how often they happen, when they happen, what they're doing, etc. Any other symptoms, any surgeries people have had, previous interventions, their current exercise regime, etc. I spend a long time gathering this history because I think it's very important to get to know the person, to get to know their pattern of behavior, their symptom presentation, their fluctuations in pain, etc. It's very important. And I think sometimes a lot of people or a lot of patients of mine are surprised at the amount of time that I spend taking a subjective history. But I believe that it's really important to get to know that person and to get to understand them properly, because I find that that makes for better outcomes, and it helps me to plan a more individualized program for somebody based around their lifestyle and the kind of things that influence them. So a subjective history to me isn't something that should just be scooted through. And I will often take an entire session just gaining a subjective history and nothing more. Then we need to look at people's posture, because posture is also very important, the way that people hold themselves. Range of movement obviously is a mainstay of any kind of physical assessment. So looking at the range and quality of movement of everybody's joints, of their joints all through their body. Strength testing, how strong, how weak are all of these different bits of somebody's body. And then stability and proprioception. So proprioception, which is joint position sense, is often something that is compromised in people with hypermobility, and I'll go on to talk about proprioception a little bit later into this presentation. But checking somebody's stability and proprioception is really important, and particularly so with people who suffer from joint dislocations and subluxations. And then gait and mobility, so how people walk, how they move, how they propel themselves along, gives you lots of clues about things that are happening in somebody. So what does the evidence base tell us in terms of putting together an exercise program? Well, there are a couple of key papers out there for anybody that may be interested around proposed evidence base for physical therapy treatments of people with hypermobility. So they go on to describe a few different approaches. And in terms of them putting together an exercise regime based on that subjective assessment, or based on that assessment that I was just talking about, there are 4 key types of exercise training that would be involved in a typical rehab program that I would structure for somebody. So there's aerobic exercise, there's strength, flexibility, and proprioception and balance. So let's look at each of those in turn. So aerobic exercise, that's your cardiorespiratory, your cardiovascular exercise, where it gets your heart and lungs pumping and transfers oxygen to the muscles. This is usually achieved by activities such as walking, treadmills, exercise bikes, cross trainers, and swimming. Now, obviously, different people have different capacity to be able to undertake these activities. Some people will struggle with some of them, and some people will be more able than others. And again, that's where an individualized approach will help to sort of tailor the ability of somebody to use any particular piece of equipment or not over somebody else. Now, the recommended amount of aerobic exercise in the normal population is 150 minutes of moderate intensity per week. And that is recommended to be broken down into 5 30-minute sessions across a week. But again, each of those 30-minute sessions can also be broken down again into 3 10-minute chunks per day, or even 6 5-minute chunks if you so wish. So the recommended amount of 150 minutes can be broken down into as many small chunks as you like. And that's perfectly valid, and people will still get the benefits even if they're breaking them down into small chunks. And breaking things down into small chunks is something that's, again, a real key component of managing a hypermobile condition. And that's one of the key elements of pacing activities, is breaking things down into smaller, more manageable chunks. So that's something, again, that we need to bear in mind whenever we're thinking about an exercise program for somebody with hypermobility, in order to break things into smaller, more manageable chunks. And people should exercise at moderate intensity. So what is moderate intensity? Well, there's something called a talk test or a sing talk test, where people should exercise to the point at which they should be able to talk whilst doing aerobic exercise, but not sing a song. If they're able to sing a song, they're not working hard enough. So that's kind of a bit of a rough guide, if you like. So how can we achieve aerobic exercise? Well, again, with my patients, I always look for ways in which these things can be done easier, can be made easier, or done at home. I don't always advocate sending people to gyms. In fact, most of the time, most of the things that I give my patients, I like to give them things that they can do usually at home, or in nice, easy ways, because not everybody likes to go to a gym, and gyms can sometimes be sort of quite intimidating places for people. So something as simple as walking is obviously fantastic for aerobic exercise, and we saw earlier where I was talking about the benefits of walking for managing diabetes. Going up and down stairs, nice, great, easy form of aerobic exercise. Again, I know that some people really struggle with stairs and can't do that, but for those that can go up and down stairs, walking up and down stairs is a lovely way of getting some aerobic exercise and some good leg strengthening as well. Swimming. Swimming is a great form of exercise. People can either swim in the pool, it's a really lovely supportive medium in which to exercise in, or simply walk around in the pool. So just getting to use your body and move your body in the water. Freestanding pedals as well, and you can use those on the floor to cycle at home. So stick them on the floor, pedal, and that's a form of aerobic exercise. And you can also take those freestanding pedals, stick them on a table, and use them as a hand bike as well. And even household activities such as cleaning and gardening can constitute aerobic exercise as well. So they can be used as a means of sort of getting that into you, if you like. Now, all exercise should be paced, okay? So again, as I was mentioning a minute ago, breaking things into smaller, more manageable chunks is really, really important when you're looking to structure a rehab program, an exercise program in view of hypermobility. So people should always start with what's deemed as a small manageable baseline amount. So a baseline amount is an amount that someone is able to do, whether it be a good day or a bad day, consistently all the time, so each day. So an amount that they're able to do without flaring up their symptoms, okay? Sometimes it takes a few goes to work out what that amount is. So you might have to do a particular piece of exercise for the first time to the point that you actually feel a bit of a flare up, but you should keep an eye, you should time yourself, keep an eye on the timer, and then make a note of what that time is. So let's say it's 10 minutes of pedaling, for example. If you know that you do 10 minutes of pedaling and suddenly you get a bit of a flare up, then 10 minutes is too much. You don't want to take it to that point again. So you would cut that in half, for example, and then 5 minutes would be a baseline amount that you could start with, because you know that you should be okay at 5 minutes. And so 5 minutes would be your manageable baseline amount that you would consistently do each time. And then you would start to build that up from there over time, adding increments on. So you have to start with a small manageable baseline amount, an amount that you feel you can cope with. And it doesn't matter how small that is. And you start with low intensity exercise, particularly if you're not used to exercising on a regular basis. Maybe something like 5 to 10 minutes, 2 to 3 times a week would be a good amount to start with. Again, you kind of need to look to do at least 2 to 3 times a week of exercise, because if you're doing any less than that, then you're not really going to gain much benefit out of it. So you need to make sure that you're exercising at least regularly enough to get some of the benefits. And as we know, higher levels of fitness can reduce symptoms of fatigue. So one of the things that people frequently tell me is that they find it very difficult to exercise because of their fatigue, and that is completely understandable. But paradoxically, the fitter you get, the more that helps with managing those symptoms of fatigue, because you get fitter and the energy expenditure in then doing any tasks or activities becomes less and takes less out of you. So over time, your fatigue can often improve as you get fitter and more conditioned. So if you're able to kind of work through it, then getting fitter and doing aerobic exercise can help with those symptoms of fatigue. And then cardiovascular exercise and dysautonomia. So for those of you that suffer from dizziness, lightheadedness, POTS, those kinds of symptoms, people with POTS, with postural tachycardia syndrome, have reduced circulating blood volume often, and that leads to an increased upright heart rate. And training can increase your blood volume. So doing cardiovascular exercise can increase that circulating blood volume, and that can help with those symptoms. Now, often in people who suffer POTS or significant dizzy, lightheaded, syncopal kind of symptoms, they may have to start with recumbent type of exercise because they might find it a bit too difficult or a bit too problematic with their symptoms if they're exercising in an upright position. So using something like a recumbent bike rather than an upright bike can be one thing to use, or a rowing machine where you're sitting down. If you're able in that position is another fantastic form of exercise. So rowers have some of the best, biggest, most efficient hearts as fantastic blood pumps through rowing exercise. And swimming is obviously a really great form of recumbent exercise because you're lying down. And that can often be a really good starting point for people who suffer from POTS-like symptoms. And there are all kinds of different suggested training zones out there. Again, I don't have time in this talk to start talking about some of those things, but there are different zones in which to try to train yourself if you're suffering from POTS. So exercising for a period of time in a steady state, and then a base pace, and then pushing yourself hard, and then slowing down again. So again, that's very individualized again to each specific person and their own individual kind of heart rate and starting point. But it can sometimes take months. It can sometimes take at least a couple of months in cases before some people are able to even exercise or consider exercising in an upright position. So very often, people will have to accept that if their POTS-like symptoms are very profound, that they may have to exercise for the first few months just in recumbent positions until they're more able to graduate upright. And then we come to strength and strength exercise. So strength exercise enhances muscles, ligaments, tendons, bones. And being stronger reduces the risk of injuries. So again, people with hypermobility will often be predisposed to picking up injuries much more easily than other people. And I dare say those of you that have done exercise or sport in the past may well have found that you're constantly getting soft tissue injuries all the time. So being stronger can help reduce the risk of injuries and also provides additional support to your joints, gives you greater capacity to undertake physical and functional tasks. So everyday activities, if you're stronger, everyday activities become easier in many cases because you have that greater strength and endurance to do things. It provides additional support to painful and flexible joints. So when you have hypermobility, you have joint flexibility. And when you have flexibility, you need to gain stability where you can. You can't change that inherent laxity within you, but you can build the strength around lax, unstable joints. And strengthening helps around those flexible joints, and it significantly reduces the risks of dislocation and subluxations. And it increases your resting metabolic rate as well. So the bigger the muscle mass, the more fuel you burn, and that can help with weight loss. So again, with strength exercise, once again, we need to work out a baseline number of reps per exercise that people feel that they can manage without flaring up their pain. So again, the same principles apply. You need to work out how many of these exercises, how many repetitions of this exercise can I do safely, comfortably, before it becomes a problem to me. And you stay in that zone. So you don't push yourself to the point that you feel a significant flare up of symptoms, because then you're doing too many. You need to stop before that point. Okay. And then you use a paced approach over time to incrementally add more reps or more sets to those exercises, but very, very gradually over time, introducing them slowly one by one. You need to do movements with control. So you need to make sure that the strengthening exercises that you're doing are done with good technique. And obviously that helps if you use things like mirrors to look at yourself and to see what kind of positions you're in. And again, it helps obviously if you're working with a physio can guide you and have a set of eyes on you and make sure that you're doing things with the right form and the right technique. But also, it can take time to notice changes. So don't expect that you'll start doing strengthening exercises and 3 days later, everything's going to be fantastic. This can take time. So, patience is something that, you also have to be mindful of. Now, how can we gain strength exercise? Well, you have to use some form of load in order to build strength. And load can come via resistance bands, dumbbells, body weights, even gravity. Doesn't matter, just as long as you're getting a resistance of some form, a load of some form. So, I use all and any of these methods with my patients. And there's a whole variety of stuff that you can do with all of those pieces of equipment. They're incredibly versatile. Hundreds of different resistance bands exercises, use dumbbells in loads of different ways, and body weight, as the picture there shows, even things like just sit to stand from a chair is a nice, leg strengthening exercise, or glutes, for example. So again, like I said before, I like to use simple, minimal equipment. You don't have to go down to a gym and use gym machines. I mean, great, if you like going to the gym, then all the better, fantastic. That's gym machines can be superb pieces of equipment and can help with strengthening, but you don't have to do that. You can get just as good benefits from using simple, minimal equipment. And again, another form of strengthening that I really like to advocate as well is Pilates. So I like Pilates for my patients. The essence of Pilates is all about building core strength, and core strength is very commonly, most frequently lacking in many people with hypermobility, or at least in need of improvement, shall we say. And Pilates is a really nice, gentle form of gradually building that strength up. And I would caution that it should be Pilates modified Pilates for a clinical population, because there's all kinds of different Pilates that are out there, and Pilates as a form of exercise in itself was actually originally created for a dance population, and some Pilates exercises can be really high level and you know, can be very scary and probably a bit beyond what people need. So I would say basic mat work exercises for a clinical population would be perfectly fine in terms of my patient group and a hypermobile patient group. If you're going to do a Pilates class, then it would be a good idea to inform the instructor about the fact that you have hypermobility before you start, just so that they can keep an eye on you. And with Pilates and with mat work Pilates, the beauty of it is there are different levels for each exercise that people do. So within a class, everybody could be doing the same exercise, but a different level of it, so a different intensity of that exercise. So if you've told your instructor that you have certain issues or certain problems, then hopefully they should be able to modify the level of that exercise that they're about to demonstrate for you, so that it's suitable for you. And if you're going to do Pilates at home, so you don't want to go to a class, or you can't go to a class at the moment anyway, then make sure that you pick a beginner's level to work from. So again, there's DVDs that are out there, and all kinds of YouTube videos and things. So make sure that you look for a beginner's level. A couple of examples as well. There's the APPI, the Australian Physio Pilates Institute. They do a standing Pilates, beginners Pilates DVD. I don't know if they've got an online stream of it or not. I dare say they may well do. But something like that is a good level. And some of you may well be familiar with Jeannie DeBon, who is a Pilates instructor based here in London, who likes to work with a hypermobile population. And she has a website where she's got lots of content that people with hypermobility can access, and is a very suitable level. And again, exercising in the water, hydrotherapy can be another really good way of strengthening as well. So there's all kinds of water weights, dumbbells, weighted belts, etc., for exercising and gaining strength. And if it's good enough for our canine friends, then I'm sure it's good enough for us. Flexibility. Now, this is sometimes something that people are very sort of surprised about when I talk about flexibility. It seems a bit ironic, doesn't it, that I should talk about flexibility with hypermobile people. But people with hypermobility can get stiff as well. Global muscles can often overwork and get tired, which can cause ache and muscle spasm. So often people with hypermobility, because they have instability in various parts of their body, other parts of their body are trying to find stability from somewhere, and you get what's called inappropriate muscle patterning going on. So certain muscles are overworking and working more than they should do, and working incorrectly. And this is where you get this kind of overwork and this ache and this muscle spasm, and that can lead to stiffness in some areas sometimes. So sometimes some of those parts need to gain a little bit of extra flexibility. And stiffness can also occur through pain and disuse as well. So if people are particularly sedentary, then they can stiffen up in certain parts of their body. And also pain can cause that as well. So in terms of flexibility, I always advocate people changing position regularly. So not staying in static postures for long periods of time. And loads of people are obviously very guilty of doing that, particularly when it comes to things like sitting at desks or sitting in chairs. They'll plonk themselves down and they won't get up again for another 3 hours. And then they'll get up and complain that, you know, they're stiff, they're sore, they're achy. Or alternatively, someone will be sat down for a really long period of time and then they'll only get up when their back starts killing them, for example. And then it's too late because they've waited for that problem to occur. Whereas actually, if you get up and change position regularly and move around regularly, then you're going to avoid getting those problems in the first place. So it's really important to make sure that you change position regularly. Okay, and by regularly, you know, in an ideal world, it would be great to get up and move around at least every 30 minutes. And you don't have to sort of get up for an hour. It's just getting up, you know, 5 minutes, walk around, move around, make a cup of tea or do whatever. And then you can go back to what you were doing. But changing position is really important, to help you sort of, you know, avoid that stiffness. Then gentle stretches. Gentle stretches, I'm fine with my patients doing gentle stretches. That's perfectly acceptable. Or even mindful movement, which is a form of gentle controlled movements. So, you know, moving slowly, moving gently in normal ranges. But I always say to really take care not to overstretch into hyperextended positions. And this is really, really important. Okay, so people will say to me, how far should I stretch? How far do I go? Well, I think that you should just stretch to what's perceived as normal ranges for the normal population, okay? And I know that a lot of people feel like they need to take the stretch into those extreme hyperextended range, otherwise they won't feel it. But my mantra is just because it goes there doesn't mean you should take it there, okay? So even though you can get your, you know, your hip into you know, God knows where of a range, doesn't mean that it needs to go there, okay? And just because you don't feel it, if you don't take it to that extreme range, doesn't mean that you're not getting a benefit to that, okay? So you don't need to go into these hyperextended ranges, and you don't need to take it to the point that you're stretching it so far that you can feel it. As long as you're stretching joints to, or taking joints to normal ranges, then that is perfectly acceptable, and that's good enough. Then we come to proprioception and balance. So as I mentioned earlier, proprioception is the body's ability to sense position and movement within joints. It's to know where our limbs are in space, to have that awareness of where our joints are. And it can often relate to coordination as well. So if you don't have a good awareness of where your joints necessarily are around you, then that can make you often a bit uncoordinated and clumsy. And I dare say that there's people here that probably relate to that, who knock things over, bang into walls, tables, reach for things and misjudge them, and etc. And this often relates to proprioception. Now, there's all kinds of hypotheses as to what may be behind this. Could be related to the laxity of tissues, things called Golgi tendon organs, joint capsules, muscle spindles within our bodies. There's all kinds of theories postulated, and nobody's absolutely entirely certain at this point in time. But what we do know is that people with hypermobility will frequently have impaired proprioception. And the other thing with poor proprioception and impaired joint position sense, this can really lead to joints slipping out of place and can lead to dislocations and subluxation. So there are several different ways in which we can train or retrain proprioception. And that's the beauty of it. Just because you may have a bit of an impaired proprioceptive system, the great thing is it's something that can sharpen up. It's something you can train up. And there's all kinds of different ways. So Tai Chi is a really nice form of exercise. That's like a mindful movement, a gentle movement, and it's slow, controlled movements, and you can control your joints and control your body and your body positions doing Tai Chi. Doing things like single leg balance work and balance exercises on the Wii Fit, although that's probably old school technology now. I'm probably falling behind, but Mirrors as well. Mirrors are an absolutely brilliant way of gaining proprioceptive awareness. So a lot of the time, people with impaired proprioception may, for example, stand with their knees in hyperextended positions and not even realize that they're in that position until they catch sight of themselves in a mirror. And then they can see that, and then that can help to correct the position that they're standing in. So I'm a big advocate of using mirrors to get visual feedback for the positions that you're in, so you can keep seeing it for yourself. Tape can be really helpful. So tape can be helpful to give people feedback as to the correct position of joints. I mean, it's not a cure or a solution in itself, but it can offer you temporary feedback so that you get the feel of where things should be. So tape can be helpful. Using things like wobble boards are again a really nice form of retraining proprioception and balance. And then compression garments. And compression garments can be really useful both for gaining proprioceptive feedback. So that compression gives feedback to your brain about the position that your joints are in. So compression gloves or lycra tops, tight leggings, things like that. They can be really useful for giving your brain that feedback. And also we know that research has shown that people that wear compression garments will often get better outcomes in terms of dislocation reduction of joints as well. And then gym ball. I'm a big fan of gym balls. They're very, very versatile pieces of equipment. I always like to give people different kinds of gym ball exercises. And there's lots of proprioceptive and balance type exercises that you can do using a gym ball. So many other typical classic questions that I often get asked when it comes to exercise and hypermobility is, what exercise is safe for me to do? Well, lots of exercises are safe for people to do. There isn't necessarily anything off the table per se, as long as things are done to a level that you can cope with, that you can manage, and that you feel that you can control. Okay, I mean, the next question: are there any exercises that I should avoid? Again, I think, you know, being smart and sensible and knowing your own limitations is part of that process. But again, most things are open to everybody, as long as they're of a level that's suitable for you and a level that you can control. I mean, yes, there are certain caveats. I mean, there may be some of you out there that perhaps have classical EDS or vascular EDS, in which case there are definitely considerations that you need to be aware of. So people with those conditions would need to avoid high impact activities or activities that cardiovascular exercise that pushes their heart rate too high, for example. But aside from that, then by and large, most exercise is open to most people. You just have to build and graduate and pace your way into those things. How can I avoid deconditioning? Well, you can avoid deconditioning by exercising on a regular basis. So making sure that you make that a ring-fenced part of your routine, that you place a level of importance on your own health and well-being, because often people will prioritize everything and anything else above themselves. And again, that's perfectly understandable. People prioritize, you know, all kinds of different things as being important, but you are important as well. And the thing is, the more that you can look after yourself and condition yourself, the better you're going to be for everything and everyone else. So, you know, the more productive you'll be in terms of work, the more productive a parent you'll be, you know, the more you'll be able to manage to do stuff. So if you invest that time in looking after you and conditioning you, then you give the best of yourself to everyone else. So it is important to ring fence time for yourself to do your exercise and conditioning. Should you do stretches? Yeah, as mentioned before, stretches are perfectly fine for people with hypermobility to do, but just make sure that you don't stretch into those hyperextended ranges. Can you exercise at home without having to go to the gym? Absolutely. Most of the exercises that I give my patients are home-based exercises. But equally, for those people that have access to a gym and are happy to go to a gym, brilliant, go to a gym. Gyms are obviously chock full of equipment that is suitable for people, and people with hypermobility are just as valid users of pieces of gym equipment as you know, as the gym junkies that are in there. So there's nothing stopping anyone with hypermobility from using all kinds of different gym machines and pieces of equipment that are out there, as long as they're at a level that are suitable and manageable for you. And how much exercise should you do? Well, here, exercise prescription. So principles of safe exercise should be slow, progressive increase in activity. And you should start with an initial short duration and frequency. So as mentioned, I think you should be looking to do at least 2 to 3 times a week. 3 times a week really would be ideal. I mean, if you're exercising less than 3 times a week, as mentioned, you're probably not going to achieve enough benefit from it. So you need to exercise at least 3 times a week, and then look to gradually increase the duration and frequency, maybe building up to 4 times a week and increasing the duration of each session that you do, with an aim of looking to do about 20 to 30 minutes of exercise most days of the week. That's what we would ideally hope for. And then you need to monitor yourself by the level of carryover pain after activity. So this is an important sentence. Hurt doesn't equal harm, okay? So when you're exercising, particularly if you're unused to exercise or haven't exercised for a long time, then it can be, you can expect to get soreness, but that's normal. But raging pain, if you're exercising, is not something that you should be accepting, okay? So I usually tell my patients that if they're doing a form of exercise, if they feel a little bit uncomfortable or a bit sore after, then as long as that dissipates, you know, within an hour or two after exercising, then that's perfectly acceptable, because that's a normal part of the process. But if you're in raging agony and that pain just lingers around for ages afterwards, then that exercise is either unsuitable for you, or you're pushing it too hard or doing too much of it. So that is not an acceptable place to be, okay? But just because something is sore or aches doesn't mean that you're doing yourself any harm, okay? It's not good if it's raging pain, but a bit of soreness or a bit of discomfort is actually okay, is acceptable. And also remember that exercises can also have time, can take time rather, to have an effect. So again, like I mentioned earlier, once you start an exercise regime, don't get discouraged or disheartened if you've been doing it for, you know, a couple of weeks and you're not noticing any kind of immediate changes, because sometimes these things do take time to take effect. Make exercise fun. So create a nice environment for yourself. Have nice smells in the room, you know, light a nice smelling candle or something like that, and put some music on. Exercise to your favorite music, you know. Make it a nice environment for yourself. Exercise with friends or family. That can be motivating and helpful, especially on those times where you maybe don't feel like exercising. It's useful if you've got a friend or a family member who can then say, oh, come on, you know, it's time to go, let's do it, let's get on with it. And again, like I mentioned before, just some considerations for people that may have classical EDS or vascular EDS. They need to avoid contact sport and high intensity activity, and they should really focus on low impact aerobic activity like swimming, exercise bikes, low to moderate load strength training, so not heavy strength training, and just basic balance and proprioceptive training. Now, there was an interesting article that came out in 2017 about exercise beliefs and behaviours of individuals with joint hypermobility syndrome and EDS hypermobility type. And this paper was on the basis of 946 questionnaires that were sent out to participants. And the findings were that participants who received exercise advice from a physiotherapist, this is a shout out to physios, were 1 3/4 times more likely to report high volumes of weekly exercise. than those who had no advice from physios. However, participants, irrespective of whether they had advice from a physio or not from a physio, participants who believed that exercise is important for long-term management of their condition were 2 3/4 times more likely to report a high volume of weekly exercise compared to participants who didn't hold this belief. So if you value exercise and you believe it's important for managing your condition and you understand the worth and the value of it, that should keep you motivated to continue to keep going with it. And then coming back to working with physios again, 3 themes emerged of the experience of people who worked with physios. The physiotherapist as a partner, so working collaboratively with the individual, the communication and knowledge of the physio that they're working with, and the experience of that physio and their regard to the safety of the patient exercising. And in terms of that, for implications, exercise, the paper determined that exercise is a cornerstone of treatment for EDS, that pain, fatigue and fear of injury are frequently reported barriers to exercise, as everybody I'm sure is aware of, but advice from physios may significantly influence exercise behavior. So if you work with a good physio who's understanding of your condition, that can really help influence your willingness to exercise. And if you work with a physio who has good condition-specific knowledge and good communication skills, then that can facilitate a positive therapeutic experience as well. And then also, along with all of the exercise that I've spoken about, so exercise, as important as it is, and it really is an absolute mainstay of managing the condition, education is also really important. Knowledge is power. So understanding about your condition helps to dispel unhelpful beliefs. So the more you understand about your condition, the more you research and the more information you get about it, can also help to decatastrophize some fears and anxieties related to the condition, and can also help you to understand the other aspect, the other key mainstay of managing this condition, the condition management, lifestyle management, pacing part of things as well, okay? Because exercise and conditioning is one part of managing this condition, but the other is managing your lifestyle and patterns of behavior. So getting understanding and education around that aspect is also really important. So in summary, exercise can help with the pain from stiffness and deconditioning. It can give you more energy to help with fatigue. It can help improve your overall stability. It can help reduce the risk of injury. It can reduce the frequency of dislocations. It can help reduce the symptoms of dysautonomia or POTS. It can help release endorphins and enkephalins, those feel-good hormones, aiding mood management. And mindful movement can also help take the fear out of moving and using our bodies. So many benefits of exercise here. It's just fantastic. And it can generally enhance your health and well-being. But you also need to have realistic expectations. And I've just put this in just to add that exercise will almost always be beneficial, but it isn't an absolute guarantee of pain relief or significant symptom improvement. And it's important to realize that as well. It's important to come with realistic expectations, because sometimes I do get patients in my clinic with certain unrealistic expectations that they'll do a couple of sessions of exercise that I've given them, and that things will be 1,000 times better, or their pain will be, 50, 60, 70% less perhaps. And, we hope to improve all of these things, but it isn't always an absolute guarantee. So realistic expectations is important. And sometimes the value of exercise is also in preventing regression, which is also very much a positive outcome. So stopping people getting worse, stopping people deteriorating, so exercise is really, really important sometimes for maintenance as well. But exercise needs to be incorporated in conjunction with an overall biopsychosocial holistic approach to condition management. You are whole people, and you have influences from everywhere upon you and your symptoms and your presentations. And so a holistic biopsychosocial approach is absolutely paramount in managing this condition. So exercise fits as one piece within that overall jigsaw. So with exercise, try not to think about doing exercise for exercise's sake. Think of it as a means of you being able to achieve more meaningful activities in your life, okay? So whilst you're doing your exercises, if you're having one of those days where you think, oh, can't be bothered to exercise or whatever, try and think of it as that gateway to you being able to do the things actually that are meaningful to you, okay? And it really is the best medicine. But make sure that you're careful when you're exercising as well, because it can be a bit dangerous at times. Come on. And that's my presentation.
Thank you so much, Jason. That was really great. Thank you.
You're welcome.
Bit cringy. They just make me go, oh, at the end. It just reminds me, last week we had funny enough, had a session with Julie Debon for some of our members. They'd chosen that. And one of the ladies was lying, they'd chosen a safe space in their house. And one of the ladies in her spare bedroom, and halfway through the session, one of the kids came in with the door and smacked her straight in the head while she was lying on the floor. And, you know, everybody else is down and calm, and I'm at the screen going, are you okay?
Yeah.
So be careful where you exercise.
Absolutely. Be careful where you exercise. Don't exercise around animals,
children, cars, anything like that. No, Thank you so much. That was really interesting and really helpful. We've had don't exercise around cats. Absolutely. Loads of messages coming through thanking you so much. And we've had loads of questions in the chat as well. So do please pop your questions in there if there's something you haven't thought of. So I'll just start with some questions, Jason, if that's okay.
Sure, I'll do my best to answer them. No guarantees, but I'll try.
Right on the spot.
Yeah.
Is it possible to strengthen your grip or your fingers?
Interestingly enough, I was having this conversation with one of the hand therapists who I work with, Bertie. To a degree, it is, yes, you can strengthen your grip. And you can strengthen the little muscles of your fingers. It's, to be honest, most of the grip and movement in your fingers is actually tendon related rather than muscles per se. But yes, you can. So you can get little pieces of TheraBand, tiny little loops of TheraBand, for example, and you can work different joints against resistance. And there's TheraPutty that's out there as well, and you can squeeze it. So different sort of resistances of putty. And you can use the putty for doing different kinds of finger and hand-based activities. And there are measures. There's something called a grip strength dynamometer out there, which can measure the outcome of somebody's grip strength over time. So it's something that can be monitored. But yes, it is possible. I mean, I would say you can make some changes. It's difficult to make huge, massive strength changes in small finger joints. And sometimes if you've got instability of small finger joints, then a lot of the time you will probably need supports, things like ovulate finger splints and things to stop hyperextension of these little joints. But yes, it is possible, and definitely, you know, my colleagues and I give out little small finger and grip strengthening exercises to people. So yes, it's definitely possible.
Lovely, thank you. One of the questions we've got, it's sort of a rare heads complication, and please excuse me if I've said this wrong. Visceroptosis?
Oh, right.
Falling of the organs.
Yeah.
And the question is, should people with falling organs be upright doing walking? Like the exercise benefits versus increasing the organs sort of dropping, I guess. I don't know whether that's one you can answer.
Yeah, it's difficult. I mean, I think in that case, that's one of the things that particular individual would need to have a discussion with their rheumatologist about in the first place, to really understand, you know, the severity and the risk factors involved for that particular individual. So it's difficult to give exercise advice in that particular case without knowing, because that's a very person specific thing.
What are your thoughts around using TENS machines to relieve pain temporarily?
Yeah, I think they're fantastic. I really like TENS machines, but TENS machines, you know, it's different strokes for different folks. So some people love them. Some people absolutely wouldn't be without a TENS machine and can get superb benefit from it. And other people, it doesn't make any difference whatsoever and doesn't change it. So it's a trial and error thing, you know. But I'm a big advocate of TENS machines. I at least like to trial them with people who are suffering from, you know, quite significant pain. I find that, you know, certainly you've got nothing to lose by giving it a go. And they're very portable, versatile, adaptable pieces of equipment. So, you know, a TENS machine gives you instant relief. If it gives you relief, it will give you relief instantly, straight away. So you put it on, turn it on, and then it's there. And the beauty of it is its portability as well. So you can wear it and you can carry on going about your business, going anywhere, walking anywhere, doing anything, and you can have it tucked away, and people don't even need to know you're wearing it or using it. And you can wear it for long periods of time throughout the day as well. I mean, make sure that you take the sticky pads off, you know, every couple of hours or so, just to give your skin a bit of a break, so you don't get any skin rash, irritation type things. But yeah, I mean, I think TENS machines are really, really good. And I use them a lot with my patients. But as mentioned, you know, some people will absolutely adore them and get on great with them. And other people, unfortunately, they don't always work so well with. But I think they're always worth a try if you have a sort of persistent pain issue that you're struggling with, then yeah, TENS can give you a little bit of instant relief.
Lovely, thank you. Is it beneficial to walk barefoot? Can you correct or help flat feet with exercise, or is it just insoles? So 2 questions there, I guess.
Yeah, is it beneficial to walk barefoot? No more so than walking with shoes on necessarily. It would be more beneficial to walk barefoot on sand, where your intrinsic foot muscles actually are going to work harder. So if you're going to walk barefoot on sand. But I think just walking around barefoot isn't in itself necessarily going to strengthen any kind of fallen arches. There are, again, some foot exercises that people can do to try to help build the intrinsic foot muscle strength. But again, I mean, you know, pronated feet, dropped arches, this is a super common presentation in people with hypermobility. You know, it's the laxity of the tissues. It just causes those feet to drop. And by and large, orthotic insoles really are generally the best solution to that, because it's very difficult to kind of rebuild an arch, if you like. But again, you know, flat feet are sometimes a problem that I would say physios often are guilty of worrying too much about. So lots of people have flat feet and just carry on, and it doesn't necessarily relate to significant problems. So just because you have flat feet doesn't guarantee that, you know, it is in itself a problem. So yes, I think if they're quite pronounced, then orthotic insoles would probably be the best way to go. Yes, you can do some small intrinsic foot strengthening type of exercises. And I would actually give probably greater consideration to foot position if people are suffering from things like knee pain as well, because you're a whole chain. So often what I find is people that that will present with sometimes quite significant knee pain will actually be having issues down with their feet position. And if you can work at either getting good orthotic insoles to correct that alignment, that can work its way further up the chain towards the knees, which sometimes can then help with people's knee pain. So to me, it's more value when it's kind of in conjunction with that.
Lovely, thank you. I'm very aware we're kind of running out of time as we go, so I've got lots more questions. So I'm just gonna, there's a few that are about sort of the same thing. So are there any strengthening exercises that you can do for your neck if you have specifically hindbrain herniation or just that kind of loose neck feeling?
Yeah, so again, hyperlaxity of the neck is, again, a hugely common symptom amongst people with hypermobility. So it's a very, very common finding. You know, it wouldn't be unusual if I got every single person in this forum right now and sent them to an upright MRI scanner for a dynamic MRI of their neck. 90% would probably have hyperlaxity of the neck. It's one of those things that actually is, you know, it's very common in the condition. It doesn't mean that it's anything to be significantly worried or concerned about. It's just another part of you that's loose and flexible. Yes, there are lots of exercises that you can do for neck strengthening, all kinds of different. There's things ranging from strengthening deep neck flexor muscles in lying positions, lying down, to sitting, to using resistance bands to work those deep muscles, to vertical loading type exercises where you have weight placed on your head and using those to help improve neck stability, neck control, and posture. So I tend to use some of those vertical loading exercises quite a lot, actually, for neck strengthening and stability. So yeah, there are lots of exercises that can help improve an unstable or a feeling of neck instability or weakness. But improving somebody's posture as well, obviously, is a big part of that. Because if you're one of those people that stands with the head sort of stuck miles out and a forward head position, then you're significantly disadvantaging your neck muscles in the first place as well, because they're having to work 10 times as hard to hold this heavy object up. And in terms of the hindbrain herniation and stuff, yeah, again, sometimes those are findings that are frequently found in the hypermobile cohort as well.
Thank you.
I would still approach the neck strengthening in the same manner.
The same way, thank you. And I think so. We'll have this as our last question because there's a few questions around this as well.
Yeah.
If you're sort of quite unbalanced or lopsided, or you sort of feel out of line somehow, can exercise alone correct that, or should you see a physio or an osteo to sort of correct it and give you, I suppose, sort of help you to correct it through them rather than just exercise?
Well, I guess I think you have to try and determine what the sort of imbalance is, or why people are feeling out of line, and what that sort of misalignment is. So, I mean, you know, to my mind, is in order to approach something like that, I would want to do a full assessment of somebody, have a look at them, you know, their posture, their movement, their range, their strength, their alignment, and see if I can determine perhaps what bits might be either short and tight, or long and weak, or just, you know, underworking or overworking. What might be causing those particular imbalances that somebody is feeling? So there might be obvious reasons why someone feels a bit out of kilter. You know, it might be that they're particularly weak in a certain area, or, you know, muscles are underpowered in a particular area, or their alignment is you know, poor in a particular joint. So, you know, to answer why or what I would do, it very much depends on what I would find. So, you know, if someone's very short, very tight, or they're leaning over to one side, I would want to know why that is, what's happening there, and, you know, based on what I find, I would then try to correct that. So, I mean, I think if you're feeling very much out of kilter and you're feeling very misaligned, then I guess the ideal thing to do is get an assessment from someone who can, you know, review you, look at you, and try to determine what might be causing that underlying, you know, malalignment.
It's more about the cause, isn't it?
Exactly.
Yeah.
It's more about cause. It's always about cause. So, you know, to me, whatever's troubling or bothering someone, you need to try to find what that driving factor is. So, you know, if someone presents with misalignment of their body, what's causing that misalignment? You know, if someone presents with pain in a hip, what's driving that pain in the hip? You know, you have to do your detective work to try to work out what's causing this to happen, what's driving this thing, and then you correct according to that, to what you find. So yeah.
Lovely, thank you. And my final question, because after these sessions, I'll, however many people are in the room, I know generally tend to get an email from each of them saying, how do they get in contact with you, Jason, if they want to, if indeed they can? Can you be referred into? Can they contact you direct?
So probably the best way to get in contact with me would be through my clinic at Wellington. So I can give you, Nikki, a contact email, and you can pass that on afterwards.
It's easier to ask you now rather than email you 20 times after the meeting, that's all.
Sure.
So thank you so much, Jason. I don't know whether you can see the chat, everyone just saying how useful that was and interesting, and
oh, good.
You know, thank you so much for your time joining us today. We really, really appreciate it. And thank you to everybody for coming along. I really hope you've got some useful information out of that. And, you know, any questions, anything after that, please do contact us and we can try and get the answers for you. And just as a reminder that you are all members in here. So when you log into the EDS UK website, into your membership area, it'll probably take a couple of days, but this video then will be there. So if there's things you think you've missed or things you want to listen to again or bits of the presentation you want to see, it will be available there for you. So again, thank you so much, Jason, and everybody, please enjoy your, well, it's still snowing here now. It's absolutely coming down thick. So I don't know where you are, whether it's snowing, but enjoy it if it is, and stay inside if you don't like it. Thank you so much, everybody. Have a lovely weekend. Thanks, Jason.
You're welcome. Thank you.
Bye-bye.
Bye.